Hello everyone, I am Dr. Chinnababu Sunkavalli. I am a consultant surgical oncologist based out of Hyderabad. Today we'll be talking about a role of radiotherapy in treating oral cancers. So the radiation therapy always gives some kind of an X-rays or a particles which destroy the cancer cells and slow their growth, and thereby it also helps in cure of the disease. So based on the stage of the disease in the oral cancers or in the oropharynx, basically radiation therapy can be given different ways. So the role of radiotherapy could be just a alone radiation, wherein for a small oral cancer, radiotherapy alone can take care, and where people cannot have a surgery, we can give radiotherapy alone. Similarly, radiation after surgery, what we call as adjuvant therapy. So this is something that is delivered after the surgery is done, and sometimes there could be chemoradiotherapy or only radiotherapy, that is basically to kill the cells which might have been left behind because they were too small to be seen or to the naked eye, and the risk of disease coming back is high based upon the final pathology report, and for such people, after the surgery is done, radiation or chemoradiation is given. So it helps to basically reduce the chance of recurrence of the disease coming back in the future. So before surgery, if we give radiotherapy, it is called as neoadjuvant therapy. So sometimes it can be given with chemotherapy, what we call as concurrent chemoradiotherapy, or sometimes it can be just a radiation alone given before the surgery is done. So this is basically to shrink the tumor, to make it much more smaller, and then do the surgery. So this makes the surgery less extensive, and probably you can also remove less tissue after neoadjuvant radiotherapy or chemotherapy. So with a targeted therapy, sometimes for larger tumors, chemotherapy is not an option, and then we can give radiation along with the targeted therapy. Sometimes radiation is given for oral cancers even to ease the symptoms. It is called as palliative radiotherapy. Suppose someone has got an advanced cancer and he is bleeding. So you can give a hemostatic radiotherapy, wherein it helps in reducing, stopping the bleeding. Sometimes radiation can stop the pain. Sometimes radiation can help in improving the swallowing itself. So where you have a dysphagia and it is closed inlet, so that's where it can help in swallowing as well. So to treat, sometimes radiation can be given when the disease has come back, what we call as recurrence. And it is also a palliative radiotherapy. Radiation and chemotherapy, if we give together, it's called chemoradiotherapy, and many times it works better, but the side effects are also more. So based on the patient's general condition and the type of the tumor, we decide whether to give concurrent or to give alone. Thank you so much for watching this video.